When I was little, I remember I had a favorite book called Betsy and the Doctor, and it was a story about a little girl that fell from a tree, and she had to go to the emergency room, and she was so nervous. And she was treated. She got some sutures in the emergency room, and learned to conquer her fear of medicine, of doctors. And I used to love that story because I loved how brave the little girl was, and I loved that the doctor could make her feel better and fix it. And I think that really piqued my interest in medicine years ago. And I just love that idea of working with children and making them not feel so afraid. Some of my newborn babies are now, entering first grade in the fall, and I love developing that relationship with the families and watching as the family grows and as they welcome new siblings. I like to get to know their expectations as well, and what do they feel that they want from me, and how we can foster that trusting relationship moving forward. Because I think it's a team approach. I think that the best medicine is medicine where you work together, and certainly I have the best interest of the child at heart, and I know the parent does too. And so I think if we can find common ground and what our goals are, it makes for a great relationship. I know what it's like to be up all night with a newborn that won't stop crying. I know what it's like to have a baby with feeding problems. I know what it's like when your child has a high fever and you're scared. And I do this for a living, but as a parent, you see things in a different way. And in that way, I think I can empathize a little bit better. I am blessed with a little boy and a little girl, and they keep me extremely busy. I love being a mom. It's the most fulfilling thing in the world. So I spend a lot of time with my kids. I love to travel. I love to read. I love to bake. And I love to eat. I love to go to all kinds of restaurants, and there's so many in Cleveland to choose from. But mostly I love to spend time with my family.